I think it's really, really important to share that knowledge with our patients. And what I found over my 35 years of practice is that patients are more compliant when we actually educate them in the why, not just the how. And you educate them in, why you want them to do a particular exercise, not just the how. And I think that's also true when it comes to nutrition. When you can educate them as to why sugar and junk food in their diet is contributing to their inflammation or their poor healing.
All right, so Dr. Brady, thanks so much for joining us today. Talk about your nutrition independent study course. Appreciate having you.
Thank you for having me. It was a lot of work, but a lot of fun doing this
Yeah,
nutrition course. So, and I really appreciate you tapping me and my expertise to do this course for you.
appreciate that. Yeah, so for the readers and listeners, it definitely is a lot of work for the authors for sure. This is definitely a service that they provide, which we appreciate, and it's a service that's needed because nutrition is an important topic, but I feel an underappreciated topic within physical therapy, and that's why I think this course is so important. Can you tell me, from your background and your expertise, why is nutrition so relevant and why should we as physical therapists care about it so much?
So, I really think it's important to integrate nutrition into physical therapy practice because it allows for like a more holistic approach and actually even a more comprehensive approach to patient care. And so many physical conditions that we see as physical therapists are influenced by diet and nutritional status. So I think it's important to address these factors alongside of our manual work and our exercise prescriptions because I think it can lead to better outcomes. And so, for instance, proper nutrition plays a critical role in the body's ability to heal and recover from injuries and surgeries. And physical therapists that are knowledgeable about nutrition can then go on to offer guidance on dietary changes that can support the healing process, such as consuming adequate protein for tissue repair, maybe incorporating anti-inflammatory foods to reduce swelling and pain, making sure our patients are well hydrated as well. And then, weight management. This is a huge concern for most of the American population, but also for us as physical therapists because they're coming to us and in order to recover from many chronic conditions and osteoarthritis, weight loss is part of the process. So as if we have some nutritional education, we can provide again guidance on helping our patients achieve healthy weight, maybe a little bit of weight loss, so that they can alleviate stress on joints and improve overall mobility and function. And it's kind of funny. I recently had a patient that the orthopedic surgeon required her to lose a certain amount of weight before she had a total knee replacement. And I had her lose 60 pounds and she didn't have any knee pain anymore. So I do think it's important for us to, it's a very hard place to go when you're dealing with a patient that's overweight. But I do think it's important to stress the fact that losing some weight is going to help alleviate joint pain and stress on the joints. And then, of course, for physical therapists that see athletes or people participating in sports specific, programs, we have sports rehabilitation programs. Nutrition obviously plays a really important role in optimizing their performance, enhancing recovery. So, as physical therapists, if we have knowledge in nutrition, we can again provide guidance on pre, post workout nutrition, hydration, possibly supplementation to help our patients achieve their athletic goals. And then, so many of our patients have chronic diseases and multiple chronic diseases like diabetes and cardiovascular disease, osteoporosis. And all of these diseases have a link to diet and lifestyle factors. And if we understand that, we can again educate our patients on dietary strategies to manage these conditions effectively. And, there's no doubt that these conditions do impact the healing process of our patients. And then, you know, I think one thing we don't do enough of as physical therapists is embracing wellness. We really need to be embracing wellness. And if you look at the medical community in general, we're treating disease all the time, and everybody talks about preventative medication, preventative medicine, but we need to take the approach of, being part of that wellness team to help prevent our patients from getting injured or sick, ahead of time. So, we can teach our patients the importance of balanced diet, healthy eating habits, and empower them to make informed choices that can reduce their risk of injury and illness over time.
I've seen it a lot in clinic too, with that same kind of story as my surgeon needs me to lose some weight before I have this procedure. And then after people lose weight, they actually feel better. And that correlation makes sense a lot anecdotally.
Mhm.
And as I was editing this course, I actually saw there's a fair amount of evidence to support what we're doing from a nutrition perspective also, and the link between all these comorbid conditions and nutrition and diet. And so
Mhm.
if there's so much evidence out there in the literature and we see it so often clinically, what do you think are some barriers that prevent us from integrating nutrition more frequently or having this discussion with our patients more intimately and more consistently in PT practice?
Well, I'm not sure that nutrition is being taught in the curriculum, and you could speak more to this being in the educational aspect of physical therapy. And maybe it's because there's limited curriculum space, and adding nutrition education may require cutting back on other essential topics or extending the length of a program, which may not be feasible. Um, I also think that nutrition is becoming a very specialized field. So I think that it's hard to get all the nutrition education that you need without going beyond, the basics of physical therapy as well. And while many physical therapists can certainly benefit from the basic understanding of nutrition, they may not have the in depth knowledge or training. We're not getting provided with this training to be able to give comprehensive nutritional counseling. So, I think the other thing that's important is for a physical therapist, we need to look at if we can't be providing the nutrition education, look other places like to nutritionists or dietitians to be able to work with them to help our patients as well. And then I think another practice is just the scope of our practice. It's very confusing and it changes from state to state. So, in some states, we are allowed to do wellness, and in my opinion, nutrition is part of that wellness. In other states, the only disciplines that are allowed to disseminate nutrition information are dietitians. So every state is very, very different. And so we need to understand that we've got to look at our state licensing and regulations and scope of our practice before we provide nutrition advice. And that can be very, I know for myself being in Virginia, it's such a gray area that it sometimes is a little scary to know if you're staying within the scope of your practice. And honestly, that's why I went on to get additional nutrition education and certifications to make sure that I was covering myself legally in order to be able to give appropriate nutrition education information to my patients. And then I think in the physical therapy practice, the time constraints are, really limit how much time we have with a particular patient, especially in very busy clinics where, you might be seeing 4 patients an hour. You've got so much education and so much that you have to do with that patient. Trying to add nutrition into that can be very, very difficult. And, and again, I think if you look at insurance, most physical therapy practices are bound to insurance reimbursements, and insurance doesn't adequately reimburse nutrition. So, it's difficult to spend time on nutrition when you're really not getting paid for it. So I think that that's really a problem as well. But I think despite these challenges, it's really important for physical therapists to at least have some knowledge of nutrition so that they can talk intelligently about nutrition with their patients.
Yeah, yeah, I completely agree. And there's a whole host of perceived barriers. Some of them the more tangible than maybe not. And I agree that it's difficult to add curriculum in PT programs because it's already a program that is dense with a lot of system based learning, oftentimes, and there's a challenge for PT programs to try to streamline and make things more efficient. And so adding new content, even though it is a part of CAPT's standards and elements that are required, it's hard to have standalone courses for things that are not necessarily what we classically have considered to be physical therapy, of
Right.
assessment and management of hands-on interventions and identifying how people are not as functional, but how to make them more functional. But nutrition is a part of that, as we've kind of
Hmm.
mentioned, and not knowing the scope of practice, that's a challenge also. And I think that's, for me, what I've seen as being a bigger challenge than anything else is similar to dry needling or manipulation or some of these other hot topics that we've had a whole history of challenges with. The gray area is scary. I think it can
Hmm.
be scary. And so when people aren't sure, there's a tendency to err on the side of caution, which I personally agree with.
Hmm.
But in the case where we are allowed to do nutrition education or we are allowed to provide these resources to people, I think it's essential that we have a little bit more of a concentrated expertise in that area so we can be more efficient in our clinical practice with discussing or integrating nutrition. And so, what are some ways you mentioned you've had experience and advanced expertise in this area? What are some additional ways you would kind of suggest post professional clinicians, researchers, educators gain a little bit more expertise within the nutrition field so that when they are, if they are providing that education, they can be a little bit more efficient and
Hmm.
effective with it?
Well, I think the number one way we can do it is seeking out continuing education courses like this ISC course on nutrition and the physical therapy practice. And this course covers topics such as just basic nutrition principles, dietary strategies for specific patient populations, how to integrate nutrition counseling into patient care, as well as how to navigate questions around the scope of practice. And then you can certainly get certifications or credentials in nutrition related areas like I did. I know that my co-author, she got a certification in health coaching. So that allows her to expand her scope of practice a little bit. There are a lot of different nutrition certifications available, and then if you're truly passionate, you can become what they call a CNS, a Certified Nutrition Specialist. But that's a pretty intense course, and you really need to want to spend that kind of time on a course like that. But that's certainly something that you can do. And the other thing I think that's so important is for ourselves to be practicing good nutrition habits. Most people are amazed how well they feel when they eat well, they take sugar, preserved foods out of their diet, a whole food diet. And just that relaying of how well we feel as physical therapists when we eat right can actually make a powerful impact on our patients.
Yeah, I think that's oftentimes undervalued for sure
Mhm.
is our own expertise. Sometimes in an evidence-based profession, we try to rely more on the top of that evidence pyramid and thinking about clinical practice guidelines and systematic reviews and randomized control trials. But as we know, not all of our patients fit within those studies, and sometimes the best evidence we have is what's worked for us in the past, obviously.
Mhm.
Um, and there's the old adage, and it's sometimes falling on deaf ears. It seems like is you got to take care of yourself before you take care of others, and it's very easy in these busy clinic schedules or studying schedules to overlook nutrition for ourselves, which makes it harder for everything. So I would completely agree. Is you got to take care of yourself, and honestly, I think this course helps to identify for us, not just our patients, but for us, how do we do that a little bit better and what are the implications of not doing that? And that's not just from a general perspective, but specifically to managing pain and then recovering from injury
Mhm.
or working on performance. And so if you had to for the oh, go ahead.
So, the other thing I would just wanted to say is, I think we have so much knowledge, and I think it's really, really important to share that knowledge with our patients. And what I found over my 35 years of practice is that patients are more compliant when we actually educate them in the why, not just the how. And you educate them in, why you want them to do a particular exercise, not just the how. And I think that's also true when it comes to nutrition. When you can educate them as to why sugar and junk food in their diet is contributing to their inflammation or their poor healing, your patient's going to listen to you um, more effectively instead of just saying, "Oh, you have to stop eating this food." And I think one of the most powerful figures that's presented in the ISC monograph in the nutrition and physical therapy practice is that citric acid Krebs cycle figure, where every PT learns about the workings of these two cycles, but to produce ATP, cellular energy. But it's pretty amazing when you realize all the different nutrients that actually have to go into making that cycle run optimally. So, when a physical therapist knows more about nutrition, that, allows us to educate and make better recommendations and let our patients know that, hey, you need those B vitamins and you need this and you need that to produce the cellular energy, which is going to help the healing process.
Yeah, understanding why is, I think, one of the most important things we can offer people. It's not just do this because the compliance obviously is going to reduce if people don't have the intrinsic motivation and understanding of what's going on and why they should continue something. And that's true, I think, for everything, not
Hmm.
just nutrition, but nutrition specifically. I think this course does a really good job of explaining not just the physiology of nutrition, but why it should be relevant to people. And I think that's important to remember. So that was actually one of my main takeaways as I was
Hmm.
reading through this, editing it, is if I picked this up, I could understand how nutrition changes potentially a person's health status, but also why it would be relevant for us to integrate nutrition into practice. That was one of my main takeaways.
Hmm.
What are some takeaways you would want readers or potential readers for this course to have as they go away from this topic?
Well, I think, what you just said too is, coming away with the idea or the knowledge that and the reason why the food we eat directly influences our energy levels, our vitality, our physical, mental performance, our ability to heal. Realizing that, approximately 60% of our patients have at least one chronic health condition, and many have multiple chronic health conditions. And I think this course does do a good job showing how these chronic health conditions can impact the ability of our patients to heal physically. And unfortunately, most of these health conditions are in part linked or driven by poor nutrition. And if we really truly want our patients to heal, we have to encourage optimizing nutrition in order to decrease the inflammation, address oxidative stress, give the body the nutrients that they need to heal. And then I think the other takeaway, which my co-author Carrie did a really good job, was, really outline what the roadblocks are and ways to overcome those roadblocks, and give people the tools they need if they are looking to integrate nutrition into their practice, some ways that they can start doing that. And I think that's really important as well.
Yeah, I appreciate you taking the time to put this course together. I really appreciate the effort you and Carrie put together to put this together. And I know the readers and our members will definitely benefit from it. And I also thank you for taking the time to chat with me about this. This is definitely something you're passionate about, and I
Hmm.
can see that. And I'm hoping that this kind of drives some other clinicians to be a little bit more passionate about it too, and have the opportunity to help people feel better and move better for sure.
Yes, yes. Well, thank you so much for having me.